Got a night guard to make. Let's get started. It's all designated. We're going to trim our models. This patient is having pretty severe pain all the time. So we started with just some counseling. Talked about not letting our teeth touch unless we're chewing food or swallowing food. And she tried that for a while and that wasn't helping. So we are going to put her in a night guard so that she can protect her joint, reduce inflammation while she is sleeping. If this doesn't work, then we consider going to a surgeon to do some other things. But hoping that this conservative night guard treatment is going to help fix a lot of her problem. So we're just trimming our models. All right, so we're transferring from InLab CAD over to InLab Split, where we're going to finish our design. Loading. All right, let's get our path of insertion set. Reduce the amount of undercut as much as possible. It's going to calculate some blackout to make this thing easier to put in and take out. There we go. Now, one area we might have problems with is right here. That's a pretty decent sized gap, but before I change anything on the model, I'm going to get a proposal to see. So we'll get a proposal. We may have to come back and edit that model some to close that space, but let's just see what we can do as is. Yeah. Just taking some bites out of this thing, seeing if it will calculate. There we go. Yeah, it's going to be too much. So let's just go back. Let's prepare our model by adding yeah, so we're just going to pretend like there's a bunch of tissue there. All right. So it's going to recalculate that block out. That's fine. Recalculating. Create our splint by plane. Die. At our starting point. All right. So let's bring that around. I don't like to cover the distal of the second molars. I typically just like to cover about half of it to keep it where it's at. Makes it easier to take the night guard on and off. We're just going to cover like half of that occlusal plane. There we go. Getting close. I always like to bring it around this incisive papilla. I like to imagine it's going to make it more comfortable for my patient. All right, and that is looking pretty good. Just a little bit higher on one side than the other. To make it as even as possible. So bring that side up some. That looks pretty good. All right, thickness. 2.5 is more than enough. We might even reduce that. Let's apply and give it a chance to see what 2.5 looks like. So it's going to generate a splint. It's going to need some help, which is why I'm here.
I need to sell a brand new one.
And they comped it off?
Yeah.
Yeah, okay. Well, I hope she likes it.
Yeah,
We'll see. Okay. Turn our contacts on. It's a really good starting point. We see lots of little green dots. So that's perfect. Let's start by removing the yellow ones. So some of this is just too much. There we go. And then we're going to come back through and add anywhere that we were missing green. That looks good. Okay. Looking like a Nightguard. There you have it. Thank you for watching. Have a wonderful day. Hope to see you.